I'm Jim Randolph from Pana, Illinois, and I was an emergency heart patient here at Riverside Hospital. I was traveling to Bridgeview, Chicago area, when I was beginning to experience some heart symptoms, realizing I was having a cardiac event. I thought I better pull off the highway and call 911. I wasn't sure how things were going to go from that point. When I arrived to Riverside, there were a team of people at the doors, and they gathered on the side of my bed. And as we came through the doors, I remember seeing Dr. Hariani. Let's go, is what I kept hearing him say. And as we're going down the hallway, I'm just fascinated that this isn't a movie like you see, this is the real thing. It was real reassuring when I came in the ER because I could tell that this team had practiced for what they were doing.
When people are having a heart attack, you're basically blocking the artery with a clot. So muscle is not getting blood, so you start damaging the muscle. So the faster you open up the artery, the faster muscle recovers. So this patient, we were informed, Mr. Randolph, right away me and the cath lab team was in the emergency room. As soon as he arrived, after checking him for a couple of minutes, we took him down to the cath lab as soon as possible, and we were able to open up his artery within 21 minutes, which was actually a record time.
I got a call from Rosa, his heart cath lab nurse, and she said that everything went well and just reassured my daughter and I both that he was doing fine.
I learned later I had 99% blockage on the Widowmaker artery. So had I not called 911, had the ambulance not responded quickly, had the team not done their job in 21 minutes, which was record time from door to balloon, I may not be here today. Just to be able to hear the conversation and hear Dr. Hariani say, "Come on team, let's go, let's do this." He practiced. He wanted his team to perform. And all of the ladies and the gentlemen did their jobs. I know they did them really well. I'm glad I was their patient. So an overnight and Thursday, it looks like I'm gonna get ready to go home. And while I'm actually dressed to go and signing papers, I get a text or a call from my daughter. It says, "Mom's in the ER."
We were going out to get the car to help discharge Jim. And I knew I wasn't feeling good. My heart was beating real fast. And I just sat down at the door and said, "I can't go another step. Go get me help." So I prayed for an angel nurse. And I was thinking in my mind, I hope it's Rosa. And all of a sudden there was 2 security guards, there was Rosa and 3 other nurses, and she just reassured me right away, "I'm going to get you right to the ER, we're gonna go through the back door, you're not gonna have to wait." And so she got me to the ER, that was an answer to my prayer. The heart cath lab nurses wearing red, I knew right away that they were there. I was in such pain, and when I saw the red, I thought I'm going to be okay. When Dr. Hariani came to see me in observation, he just went like that. And I said, "I know, I'm your new patient too." And so he was very kind, and he said, "We're going to keep you overnight." And then the next morning I had a heart cath, and I was 75% blocked and had a balloon.
I was wheeled out of the hospital because I had to be wheeled according to policy. And when I got out the front door, I got up out of the wheelchair and walked back in, went to the ER, and met up with all my friends here at Riverside that were taking care of my wife. And so
all of the nurses, everyone was just fantastic. Then the next day I stayed one more night, and we finally got to go home.
We both feel younger, we both feel more energetic, and we feel totally blessed. I'm at an executive level in my business. I understand training, I understand making people work together, and this was clearly, to me, that this was a team working together, and I was very happy where I was at.
The teamwork that you'll see within our service line, our physicians, advanced practice nurses, clinicians, our clerical, scheduling, result team, diagnostic team are all working together. We meet very frequently throughout the week to collaborate throughout the office day, throughout the procedure day. We're coordinating those details for the patients. We hope that our patients will feel that their heart is in the right place, and we're all about making that experience that can be very stressful, very urgent, very challenging for families, very scary, a peaceful, positive approach for an optimal outcome.
You could tell Dr. Hariani, his heart is in what he's trying to do. I feel like very comfortable with him. I asked him if he would remain my cardiologist, and he said, well, I can, but that's 2.5 hours, which is really 5 hours when you go both ways. And I said, well, you know me inside and out, and I've got a lot of friends here now, so I'd like to keep coming here if I can. And so for now, he's my cardiologist. And I just want to say how much I appreciate the donors of this area, of this community. You have created a fabulous medical center, a cardiac center that probably is second to none. I would just encourage and urge anybody in this community that has the opportunity to give a gift of any size to the foundation, or give time, or volunteer at the hospital, or serve on the board of directors. You will not regret it. And this has just been a great reward to have my life saved here. And again, I just want to say thank you to Dr. Hariani, Dr. Clark, and all of the staff, and even to the administration that doesn't get thank yous very often. A lot of these decisions have to come from the top and all the way through. So I'm grateful. You've put a great team together, but you've also put a great program together. And we are spreading the news around Central Illinois. It takes donors and people of resources. People have the need to give. They can give to something that just didn't save my life. It saved the life of my family. The symptoms that I had the day of the heart attack, I now realize I've been having those for a long time, but they're very short. I'm using that in my association. I talk to all of our drivers, concrete drivers in Illinois, and I'm also asked by everybody, because I'm before crowds of people, what happened? What did it feel like? Other men want to know, what are the symptoms? Well, now I'm finding out they got the symptoms, and I say, you need to get to Riverside, even if it takes you 2.5 hours.
He was so excited that he signed this heart diagram, and he was so happy, and I'm so excited to get this from him.